Good afternoon, everyone. I think in the spirit of this session, we should get started. I'm Mikkael Sekeres from the Sylvester Cancer Center, University of Miami in the United States. And it's a pleasure to welcome you to this rapid fire session too. Here's the format and here's the rules. Each person will have 2 minutes to present his or her research. If we have time at the end, then we can take questions, but I will be timing you at 2 minutes, and if you go over 2 minutes, I'm going to make wild gesticulations and a lot of noise over here that you've got to stop so we stay on time. Because if we go over, then I get in trouble. I'm never invited back to this meeting. How's that for a little guilt? It is a real pleasure to start us off by welcoming Dr. Mei. Yes? You ready? To discuss research on behalf of his group. Dr. Mei, you've got 2 minutes. Go.
Okay. Good afternoon, everyone. It's a great pleasure to be here. I'm Dr. Mei Chen. I will report the final result of combination therapy with recombinant human erythropoietin plus all-trans retinoic acid and testosterone anti-actin for the treatment of lower risk MDS. Erythropoietin-stimulated engineers achieve a hematologic improvement erythroid in only 13% of low risk MDS patients, highlighting the need for developing a new strategies to improve the outcome of the patient. We conducted this multi-center study to investigate the efficacy and safety of the treatment regimen. The eligible patients received Wearable 10,000 IU per day, atrial 25 milligram per square meter per day, and testosterone and Undecanoate 18 milligram twice daily for 12 weeks. The primary endpoint was the proportion of patients achieving HIE during the 12 weeks. The result shows that in the first 32 patients of 52 patients achieved HI response. 15 of 23 patients with EPO levels below 500 IU per liter had a HI response as compared to 58.6% of those with EPO level above 500. And the percentage of patients with HIE response was higher in patients with very low or low risk than those with intermediate risk based on IPSSR. Patients with mutated AXL1 had a lower HI response rate than those with wild type. 17 of 27 patients with transfusion burden achieved RBC and transfusion independence lasting for 8 weeks or longer. The most commonly reported AEs was fatigue, dry skin, headache, and edema. 3 patients had dose reduction, and 1 discontinued treatment due to grade 3 deep vein thrombosis. In conclusion, the triple regimen of attained the HIE in 61.5% of patients, regardless of the EPO levels. And finally, we thank the patients and the families and all the investigators and the research staff. That's all. Thank you.
That's great. That was 2 minutes and 30 seconds. So you all have to tell me what Germany's like in 2 years. That's what the next MDS meeting is. It's a joke. Anyway, Dr. Liu, love to hear about your research. And go.
Thanks for your introduction. Unfortunately, my colleague Liu Linling could not be here today, so I will be delivering the presentation on her behalf. The objective of our study is to compare the clinical and laboratory characteristics in the survival of MDS patients between Chinese patients and those in Western countries. So we collected clinical and laboratory data from 1,464 primary adult MDS patients diagnosed in our center and compared them with the data from the IWGPM. we found that Chinese patients were significantly younger than IWGPM patients and had more severe hematopoietin. Chinese patients showed a higher percentage of isolated 20q- trisomy 8 complex karyotypes and a lower percentage of normal karyotypes 5q- and Y-. As for the gene mutation landscape, the mutation rates of U2AF1, NRAS, and NPM1 were higher than those of IWGPM patients, while the mutation rates of ASXQ1, SF3B1, RUNX1 were lower, and there was no significant difference in OS between two groups. Among patients aged younger than 45 years, Chinese patients had more trisomy 8 and U2AF1 mutation. The 4-year overall survival rate was higher in Chinese patients. In patients aged more than 70 years, Chinese patients had more complex karyotypes but fewer 5q-. So here's the conclusion. Chinese and the Western MDS patients differ in age of onset, clinical features, and cytogenetic or molecular genetic abnormalities with significant differences persisting in age-matched groups. Although overall survival is similar, there is still difference exist in survival for younger and older patients between the two populations. Okay, that's all. Thank you.
Very nicely done. Dr. Gat, happy to hear about your research.
Thank you, Professor Sekeres. On behalf of my colleagues, I'm happy to present our study, Diabetes mellitus in MDS. Diabetes and its complications are common, and hemoglobin A1C is a poor marker. So we compared 901 MDS patients with more than 18,000 matched controls, and the parameters investigated were the prevalence of diabetes and its related complications, laboratory results, and hemoglobin A1C. So indeed, diabetes was more common in MDS, 35% versus 28% in the controls. Moreover, the complications of diabetes were also more common. As you can see on the graph, neuropathy, retinopathy, nephropathy, and peripheral vascular disease were all more prevalent in the MDS patients. When focusing on diabetes only, comparing MDS versus non-MDS patients, these differences persisted. However, hemoglobin A1C was low. So in conclusion, diabetes and its related complication indeed is more common in MDS, but hemoglobin A1C is low. Our hypothesis is that the RBC dysfunction and the shorter survival of the red blood cell leads to falsely low hemoglobin A1C, and this results in late diagnosis of diabetes and its complications. So in conclusion, hemoglobin A1C is a poor predictor and marker in MDS. And if you have more questions, visit our poster.
Dr. Gat, that was borderline brilliant. And I say that based purely on the fact that you came in under 2 minutes. But it was very nice research also. Dr. Liu, we'd love to hear about your research.
Good afternoon. Today, I'd like to present our findings on genomic landscape and clinical outcomes of children with advanced myelodysplastic syndromes. Children with MDS is characterized by a dismal prognosis and a high frequency of mutations. The mutational landscape of pediatric MDS remains unexplored. This study focused exclusively on advanced MDS with aim to explore genomic landscape and clinical outcomes of children with advanced MDS. We performed next-generation sequencing on 72 children with advanced MDS, 54 with MDS EB, and 18 with MDS EBT between September 2011 and April 2022. In our results, cytogenetic analysis revealed that 22.4% 0.9% of children carried monosomy 7. 60 patients, from this figure, we can see that 60 patients harbored at least one gene mutation. In a total of 16 children is found to have PTPN mutations. PTPN11 mutation was the most commonly mutated genes in our cohort. Mutations in, unlike adult MDS, mutations in genes involved in the RAS-MARK pathway were the most prevalent overall. As for survival, univariate analysis indicates that PTPN11 was associated with poor overall survival and event-free survival. In subset analysis, children with PTPN11 mutation who didn't receive HSCT had the worst 2-year overall survival. In conclusion, PTPN11 was the most frequently mutated gene in children with advanced MDS. Children with advanced MDS carrying the PTPN11 mutation may have a poor prognosis and should be prime candidates for HSCT. That's all. Thank you.
Another brilliant presentation. Thank you. 2 minutes exactly, and very nice research. Can't you just feel the tension in the room with these 2-minute presentations? Like, I'm getting totally stressed out here, and all I'm doing is timing it. Dr. Schultz, I'm sure you're going to do a terrific job. We'd love to hear about your research.
Good afternoon. My name is Catharina Mundt, and I'm a medical student at the Heinrich Heine University in Düsseldorf, working in the MDS group. Today, I have the honor to present you the results of our research about the comparison of patients with about the comparison of patients with IB1, IB2, and AML-MRC in terms of time to treatment initiation, prognosis, and the influence of therapeutic strategies on the prognosis. We came up with this topic as a result of the ICC redefinition of AML by lowering the medullary blast count to 10%, just merging the former IB2 group together with AML into one category. In the first step, we looked at the time between diagnosis and the first treatment in 937 patients, and afterwards, we analyzed the median overall survival. The median time between diagnosis and first treatment differs dramatically between the 3 entities, as you can see in the presentation. Our results show that there's also a significant difference in median overall survival between the 3 patient groups treated with best supportive care only. This difference is still present in HMA, whereas there's no difference in allogeneic stem cell transplantation, which means that this therapeutic strategy is considered an equalizer in terms of prognosis. Based on these observations, we conclude that the underlying disease biology, which is represented by untreated patients of AML, IB2, and IB1, differs a lot, which is why these entities should remain separate in the classifications. Thank you for your attention.
That was perfect, future Dr. Schultz. Thank you. Very nice research. Dr. Sharma, an army of one. You ready?
Yes.
Go.
Very good afternoon. Very good afternoon, all of you. The title of my presentation is Investigation of the Wearable Technology and Geo-Fencing Device for Monitoring Health Data and Sleep Pattern in the MDS Patients. So I have nothing to for the conflict of interest in my study. So aim of this study was to evaluate the efficiency of the wearable health technology and geofencing device in monitoring daily activities like sleep patterns and the movements in MDS patients. So in this study, we have taken 110 MDS patients based on the equal number of male and female from our city and participates in a 30-day observation study. Each patient uses a firebolt sense to health watch to track the step count, calorie burn, and motion time, sleep duration, heart rate, blood pressure, and blood glucose level with the time. And a geofencing device was provided real-time auditory alerts for the movement disturbation, fall events, and boundary breach, and a daily questionnaire was assessed subject to symptoms including fatigue, cognition function, and sleep quality. So coming to the results, data show there is a significant improvement in the heart rate, calorie burn, blood glucose level, blood pressures, and more in the physically active MDS patient compared to the non-active individuals. So active participation in the MDS patient also saw an enhance in the SpO2 level and increase in the sleep duration, which is much significant compared to the controls. And also the physiotherapist observation, improvement in stability, fall reduction, memory function, and decrease wandering events, correlations are increased physical activity and structural routines in the MDS patient with the time. So coming to the conclusion, so wearable device which offer a novel non-invasive approach to monitoring movement, sleeps, data, and overall health in the MDS patients. This tool may help to improvement in the reduce in the falls and enhance patient safety with reduce in the symptoms which get affect during the MDS kind of problems and the other problem. So future research is also needed for the long-term clinical trial and benefits into the personalized MDS management in this study. Thank you for your time. I have done with my presentation.
That is really cool research, actually. I love it. Dr. Bergonzi? Love to hear about VEXA syndrome.
Can I start?
Go.
So good afternoon. I think it's the wrong presentation.
No, you have to give this one. I'm sorry.
Okay, so effect of...
Or you can do this one. Your choice.
Thank you.
This one?
This one is
the
best.
I'm resetting the stopwatch. You ready? Go.
So, good afternoon. My name is Gregorio Bergonzi from San Raffaele Hospital in Milan, and I'm pleased to present the results of our multicenter retrospective study evaluating vaccination practice in patients with VEXA syndrome. So, given the inherent clinical frailty of this patient and their increased risk of severe infection, we aim to assess both vaccination coverage and the occurrence of vaccine-related adverse events in this population. To this end, we conducted a survey distributed across 8 centers in Italy and Australia between December 2024 and February 2025. The survey collected detailed clinical data and specific information regarding vaccination history and tolerability of this patient. A total of 36 male patients were included with a median age at diagnosis of 70 years and various degrees of hematological and rheumatological involvement as shown in this table. So the vaccination coverage varied across vaccine type. Coverage for COVID-19 vaccination reached 90%, for influenza vaccines approximately 70%, while the rates were notably lower for herpes zoster virus and streptococcus pneumonia vaccines. In terms of safety, the majority of vaccines were well tolerated. Only 3 cases of VEXA flare syndrome were reported following vaccination, and interestingly, all patients carried UBA1 valin mutation, which is known to be the most inflammatory phenotype 1. So, in conclusion, vaccination appears to be safe and are recommended in patients with VEXA syndrome. However, we suggest a close peri-vaccination monitoring to promptly identifying and manage potential adverse effects. Thank you so much.
The use of the word vaccinations is absolute genius. You're going to go far in this field. Dr. Barroso?
Good afternoon. Thank you for your attention. Thank you for this opportunity sorry. Good afternoon. Thank you for this opportunity to present our results here. The aim of our research was to determine the role of ERCC6L2 in the pathogenicity of the disease, when the MDS with germline predisposition. For this purpose, we used CRISPR-Cas9 in health cell line to generate ERCC6L2 truncating mutations, flow cytometry to measure cellular and mitochondrial ROS levels, cell viability assay and mitochondrial ROS levels by flow cytometry after mitomycin C exposure, and apoptosis and cell proliferation assays. Our results showed that mutations in ERCC6L2 were associated with an increased oxidative stress level both on cellular and mitochondrial ROS when compared to wild-type cells. On the other hand, exposure to DNA-damaging agents such as mitomycin C caused decrease in cellular variability, and here an increase in mitochondrial ROS levels when compared to wild-type cells. In addition, ERCC6L2 mutations were related to increased apoptosis and reduced cell proliferation. With these results, we may conclude that the cell line model with ERCC6L2 mutations indicates that cells exhibit elevated levels of oxidative stress. This generates DNA damage that is repaired inefficiently in cells harboring ERCC6L2 mutations, contributing to the associated phenotypes. And in the context of myeloid neoplasia, ERCC6L2 mutations could lead to inefficient DNA damage repair, which could be contributing to the pathogenesis once the disease is established. Thank you.
Outstanding job, everyone. The session is over. If people have questions, maybe the speakers can congregate in the front and take those individually. Thank you, everyone. Enjoy the break.